I've had situations, memorials, funerals for people who were, in their 80s and they passed away from COVID. Then I also have, some people who were dear to my heart and they were in their early 20s. We're talking 23, 24, that age in which, they believe that, everything won't affect them because they're young, they're healthy, they're strong, until the pandemic comes and this crazy disease or this virus called COVID grips their respiratory system, and we got to figure it out. Just like anybody else in this world, it leaves me speechless. It just puts you back on your heels and try to figure out, what's your part to try to alleviate the spread of the virus.
About a third of the patients I see have been COVID. So their symptoms range anywhere between some mild cough and some runny nose, some loss of taste of smell, congestion, to being very, very low on oxygen and requiring to be on some oxygen support, whether that's oxygen through their nose, whether we have big old masks on them, or unfortunately if they get too severe, we might have to put a breathing tube down their throat. The more severe patients that I have been seeing are unvaccinated, unfortunately.
When I was first diagnosed with COVID, I had just gotten my flu vaccine, so the symptoms that I had, I thought were the symptoms of having the flu vaccine. And I didn't think that anything of it until I realized that I lost my sense of smell and taste. And then I had to be tested, and it was confirmed that I had COVID. My granddaughter, it was a challenge because we wanted to make sure that we were safe for her, because with her at that time being 2 years old, there was no vaccination for us and for her as well. So we wanted to make sure that we protected her because she could not fight the disease if she were to get it.
Us collectively as a whole here at SUMA, from the doctors, from the nurses, to the technicians, to the environmental services staff, we have all came together as a whole to try to find the best way to allocate the bed shortages and the bed wait times in the emergency department to kind of get patients in and out faster from triage.
At that time, I was an inpatient dietitian on T3, which is an IC unit where most of the COVID patients were hospitalized. And it was very challenging because I would try to do the best that I could to care for the patients, to ensure that my part as providing nutrition intervention did the best that it could to help those patients to survive. It was hard because I would see the patients be admitted, see the quick decline, and unfortunately I saw a lot of patients pass away.
I contracted COVID-19 back in March of 2020. Testing was very limited at the time. If you had symptoms, it was recommended that you just stay home. It's most likely COVID-19, and that you just essentially wait it out at home with symptomatic treatment, or just, supportive care, everything that you're trying to do at home. Now the environment is a lot different now. The fact that we have tests readily available at multiple different sites that help you get the answers that you need to figure out whether or not these symptoms that you're experiencing has been COVID-19 or not.
I got vaccinated because I felt that it was important, and that was the only way that I could do my part to fight the disease.
Why I chose to get vaccinated was to not only protect myself, but for my patients. For my profession, my job is to help heal and treat people.
So my call to action would be to make sure that you are constantly washing your hands.
Social distance every opportunity that you can.
Get vaccinated, get your booster.
We here at SUMA are here to support you. And please take every step that you can to protect you and your family.
And wear your mask.